It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. What care should I take with my pregnant dog? A dog is pregnant for 62 to 64 days. However, it can be difficult to predict the exact day of delivery because the mating date is not always the conception date. Pregnancy length can also vary slightly depending on breed and litter size. Pregnancy can be diagnosed in bitches from day 28 using ultrasound. There is also a blood test that your veterinarian can perform at the same time to confirm pregnancy. X-rays can be a very useful tool in diagnosing pregnancy, but cannot be performed until day 45. However, they are the most commonly recommended diagnostic test because X-rays can help determine litter size, which, in turn, notify you when she has finished giving birth. 1. Signs of pregnancy in dogs. Bigger belly. Increased appetite. Increase in nipple size and possible color change. Weight gain. Decrease in activity. Mucoid discharge from the vulva. Behavioral changes, such as nesting, increased affect, or irritability. 2. How to care for your pregnant dog. A pregnant dog needs a balanced, nutritious and highly digestible diet. Talk to your veterinarian about whether she recommends the current food or a gradual change to an approved growth food. At about 3 weeks into pregnancy, it is common for a pregnant dog to experience some nausea and loss of appetite. This should resolve itself within a week. Calcium supplementation is discouraged during pregnancy, as this suppresses your dog's natural calcium-releasing hormones. As long as you follow a good quality diet, supplementation is unnecessary. In the 5th week of pregnancy, you should begin to increase your food intake. Make sure meals are in smaller, more frequent portions. Your dog won't be able to eat large meals because growing puppies take up a lot of space in her abdomen. Regular exercise helps the expectant mother maintain her strength and discourages obesity. Make sure you only do gentle exercises, such as walking. Although obesity may be a common health problem during this time, pregnancy is not the time for a weight loss program. Intense running, obedience and showing are also too stressful. Be sure to avoid any strenuous activity during the last 3 weeks of pregnancy. All contact with other dogs should also be avoided in the last 3 weeks to prevent herpes infection. Canine herpes virus can cause abortion during pregnancy and death in newborn puppies. A dog should not be vaccinated during pregnancy, as she may harm the developing puppies. But it is very important that she has maternal antibodies to transmit them when her puppies breastfeed. For this reason, it is essential to discuss your dog's health with your veterinarian before mating. Your veterinarian can ensure that your dog is healthy enough for pregnancy, up to date on all vaccinations, and free of intestinal parasites that she could transmit to her puppies. 3. Stages of childbirth. During the first stage of labor, uterine contractions begin. Your dog may pace, shake, pant, or even vomit. These are all normal behaviors and do not require any intervention on your part. In the second stage of labor, stronger uterine contractions occur and puppies are born. Expect a pup every 45 to 60 minutes, with 10 to 30 minutes of intense effort. If your dog strains hard for more than an hour without any puppies coming out, contact your veterinarian immediately. The pups are born in individual membranes that the mother tears off immediately after birth by vigorously licking the pup. Allow a minute or two to do this. If she doesn't, you'll have to clean the puppy because newborn puppies can't survive more than a few minutes before their oxygen supply runs out. She simply removes the slippery cover and rubs the puppy with a clean towel until you hear him cry. The mother should also cut the umbilical cord while she cleans the puppies from her. If she doesn't, it's up to you to cut the cord and tie it about an inch from the belly. You can use unwaxed dental floss to tie the cord. Be careful not to pull on the umbilical cord, as this may harm the puppy. It is normal for a pregnant mother to rest mid-birth and she may not exert herself at all for up to 4 hours between puppies. If she goes more than 4 hours without straining and you know that she has not given birth to all the puppies, contact your veterinarian immediately. The third stage of labor is the passage of the placenta. This can occur after each puppy or at the end of whelping. It is not a good idea for your dog to eat the placenta. Dispose of the placenta yourself. She keeps track of the number of placentas because a retained placenta can cause problems for the mother. All puppies should be placed next to the mother's belly and wrapped in a blanket to keep them warm. Watch them closely to make sure they are breathing normally and that she will allow them to breastfeed within a few hours. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.